Good evening, everyone. I'd like to welcome you all to the Dauphin Regional Health Centre Town Hall meeting. My name is Jeff Martin. I am the Provincial Director of Emergency and Continuity Management for Shared Health, and I will be your moderator for this 1 hour-long event. Today's Town Hall will be recorded and shared online. Attendees will not be able to turn on their camera or microphone on during this meeting. If you have any questions, and I'm sure some of you will, during today's Town Hall, please use the question pane. If you have a question following the event, please send them to info@sharedhealthmb.ca. And of course, that email address will be shared again later in this presentation. If you're not able to get to all the questions today, if we're not able to get to all the questions today, the remaining questions will be posted online or responded to directly via email. Moved on to the next slide. All right, I'm going to go through our statement of acknowledgement of Indigenous, ancestral, and territorial lands. Between the Prairie Mountain Health Region and Shared Health, we provide health services and facilities located on the treaty territories and ancestral lands of the Inuit, the Anishinaabe, the Anishinuak, the Nahithawak, the Anuawak, the Nahayawak, Dakota Oyate, and Dene Solane nations, and on the national homeland of the Red River Métis. We acknowledge harms caused by colonialism and dedicate ourselves to building relationships and collaborating with First Nations, Inuit, and Métis people. Through this commitment and rooted in truth and reconciliation, we will improve health experiences and outcomes for Indigenous people. Shared Health Land Acknowledgement reminds us of our ongoing commitment to growing trust, fostering connection, strengthening relationships, and walking together in a good way towards shared healing and a more sustainable health system. This journey is rooted in curiosity, humility, compassion, and respect for traditional Indigenous health and wellness services. In addition to the statement, Shared Health believes it is our responsibility together to dedicate intentional efforts in creating a healthcare environment that is accessible, safe, and equitable for everyone. We also recognize that within our provincial scope, multiple ethnicities, cultures, and diverse communities exist, and that we are a designated bilingual organization. Next slide, please. Over the next hour, you'll hear an overview of the significant work that has been happening to respond to the flooding of the Dauphin Regional Health Centre since July 1st, 2026, Canada Day. Prairie Mountain Health, Shared Health, the Government of Manitoba, our fellow health regions, and our partner organizations have come together over the past month, working collaboratively to respond to this unprecedented event. We'll hear insights from the Honorable Uzama Asogwara, Deputy Premier and Minister of Health, Seniors and Long-Term Care, the Honorable Ron Kostyshin, Minister of Agriculture and MLA for Dauphin, and His Worship David Boziak, the City of Dauphin Mayor. We're also joined by Trina Slate, the Chief Executive Officer for Prairie Mountain Health, and Dr. Chris Christodoulou, Interim President and Chief Executive Officer for Shared Health, who will be providing updates this evening. Finally, we'll have what everyone's waiting for, a question and answer period where service area leads from Prairie Mountain Health and Shared Health will be available to answer your questions. Please enter any questions you have into the question pane on the GoToWebinar platform. We hope that the next hour provides both valuable information. We'll do our best to address as many questions as possible before we conclude. Next slide, please. All right, I am now pleased to introduce the Deputy Premier of Manitoba and the Minister of Health, Seniors and Long-Term Care, the Honorable Uzama Asogwara. Honorable Minister.
Hi, good evening, everyone. Can everybody hear me okay?
Good.
All right, thank you so much, Jeff. Good evening, everyone. Thank you so much for making time to be here. I know that there's hundreds of you who are joining us online, and there will be folks who are joining us as this conversation progresses. But I want to thank each and every one of you for making time to have this conversation and bring your questions forward today. We're here to provide you clarity, provide you some comfort in terms of what is happening, and to let you know that everyone is working as a team and working 24/7 around the clock to restore services in Dauphin and make sure that patients have the care that they need in their community or as close to their community as possible. So first, I just want to say that you folks have been through a lot. I know that this situation, this unprecedented challenge, is incredibly difficult for you and your families and communities. This is something that obviously nobody could have predicted, and certainly nobody asked to happen. And it is something that you're all facing. And I want you to know that we are here for you. We're in your corner. We're listening to you. And I can't thank you enough for being so willing to share your experiences, your ideas, your hopes for what needs to happen with your leaders, with your representatives, like Mayor Boziak, who's just been phenomenal, phenomenal advocate for Dauphin and a great partner to work with. And Trina, for example, your CEO of Prairie Mountain Health, and so many others. Um, I had the opportunity today to see the hospital for myself. Like you folks, many of you, I've had lots of questions about the magnitude of the damage. I've seen videos and pictures. The premier was here immediately after this happened, but I had the opportunity today to walk the halls of the hospital myself. What I saw was incredible in terms of the magnitude of the damage that has been done. It is genuinely jaw-dropping to see what this flood has done to a health center that is beloved by this community and is really a central hub for care. When we think about the fact that approximately, we did the math on this, when you look at about 45,000 square feet of that lower level in the hospital, water got up to about 5 feet throughout the entirety of it. That's over 6 million liters of water that has been pumped out of that site, which is just a phenomenal effort to remove that water. So about 6.4 million liters of water has been removed from that site through everyone's hard work. And today, what we are here to do is to answer questions, but it's also to help bring you peace of mind in terms of all of the work that's been happening. Over 90 people every single day have been on the ground at that site, remediating, draining water, cleaning up, assessing, evaluating, because we know how disruptive this has been for community members, residents in the Parkland region. We know how disruptive this has been for care, for providers, nurses, doctors, providers across the board, for families. And we understand that this isn't a level of disruption that can persist for too long. So our priority as a government from the very beginning, very beginning, has been to work as quickly as we can to stand up services, to restore capacity as quickly as possible in Dauphin. But it's really also been about making sure that people are able to continue to get safe care. That continuum of care is strong, and that Manitobans' well-being and their health is provided for and is taken care of. And so I just want to share a little bit of what's happened since the emergency started and the steps that have been taken in the region. So, we've taken steps to maintain care. You folks know that in terms of other locations where care has been stood up. St. Rose, for example, we know that there's impacts elsewhere, Grandview, Russell. But I do want to share with you that in the immediate, we're taking steps to stand up services in Dauphin. And this is the direct result of your incredible doctors, nurses, and providers bringing ideas forward, telling us what needs to happen in order for them to continue to provide great quality care. And we're able to take these steps together, really an all hands on deck approach. And so outside of the 90 staff who are on site daily doing this work, we're standing up lab services in a temporary outpatient clinic in the provincial building right in Dauphin. And so you folks can expect that by the end of next week, you are going to have lab services restored in Dauphin. So I'm talking about point of care testing, EKG, X-ray, these services, labs, they're all going to be phlebotomy. They're going to be stood up in your community. You've got X-ray services. It means you're going to have casting, right? These services will be in this clinic. I've been given a timeline. We were given a timeline of later in August. We've pushed very hard and worked with your leaders to move that timeline up. And so my expectation and what I'm sharing with you today is that you will have those lab services established in Dauphin by the end of next week, which is a really aggressive timeline. But we know that we need to meet the moment and move these timelines as quickly as we can so that your providers can do what they do best, and that's take care of Manitobans, and so that residents and community members can get the care that they need right here at home. I want to also share that we're working on getting you folks a firm timeline in terms of a mobile CT. So we've heard loud and clear from your physicians that CT services are really important. And I want to just thank the doctors who we met with today. We met with doctors and nurses from Dauphin who had a lot of wonderful ideas. These folks are not only experts in clinical care, but I have to say they're starting to develop some expertise in disaster response. They've got some great ideas about what we can do by working together to stand up more capacity right in Dauphin. So we're looking at mobile CT options. We're looking at modular capacity. We're really thinking well outside the box, because an unprecedented challenge means we have to think about unprecedented solutions. And that's what we're willing to do. And our government is going to be taking that approach every single step of the way. We know that there's still a tremendous amount of work ahead, but I think it's important to note that we've accomplished a lot in a very short amount of time. And I want to thank all of the frontline providers who have been at the heart of that. I met someone today named Shelly Nichols, I believe, who's just an incredible nurse, phenomenal energy at the community clinic, who, and her team has worked very quickly to adapt and to make sure people can get care in Dauphin. They turned a boardroom into a place where people can get care, and it's a place where we can start and we can build on, where folks are now getting, as a result of those efforts, IV care. It's a place where cancer patients are now able to get some care as opposed to leaving their community. So I want to thank Shelly and her team. I want to thank everybody who has been so willing to be nimble and be flexible and to put people first and to be a part of the solutions. Our job and my job as your health minister is to listen, and it's to work with each and every one of you and to push those timelines. And that is exactly what we are going to continue to do. So I want to thank all of those folks we had a chance to meet with today. We're going to keep working with all of you. I also want to take a second to thank Jason, who I met today, who his exact title, I'm going to find that here because I made a point of writing that down. He's the infrastructure, the facilities engineer lead at Prairie Mountain Health at Dauphin there, Jason Gibbs. Phenomenal guy. He was on the ground in the immediate hours when the flooding began and was assessing the situation and essentially has not left. This is somebody who is very clearly, passionately dedicated to Dauphin and dedicated to people. And that's what I continue to see. That's what I saw today. People who were showing up, working around the clock, seeing the hospital and the site more than they're seeing their own families, because they want solutions to come together quickly for all of you. So I want to thank him for his work. And I also want to thank Erin, who's a provider, a dietitian I met today, who shared a bit about her story and how she still continues to show up and provide care. I want to thank Trina, who's the CEO of Prairie Mountain Health. And I want to give Trina special thanks because she's your champion. She's doing just a phenomenal, incredible job, working tirelessly, bringing the voices of doctors and nurses and providers and experts together to make sure that we are all working as quickly as we can as one team, as one unit to address this challenge. And she's doing truly a tremendous job with, as she always does, leading with real compassion and professionalism. So we know that during a challenge like this, as Manitobans, the way that we deal with unique challenges, unprecedented challenges, is by meeting these challenges together. And that is the approach we are going to continue to take. It's going to take all of us, not one of us, not one single person, not one government. It's going to take each and every one of us working together to bring these solutions forward and to move things in the right direction as quickly as we can. So I just want to say thank you. Our government is deeply, deeply grateful. I can say that my colleague, Minister Kostyshin, who is your MLA for Dauphin, who was here with us today on the tour and has been out, paying close attention to this every step of the way. We're deeply grateful for how hard everyone has been working and for the way everyone has been working together. Tonight is about listening to you folks. We're here to hear your ideas. We're here to hear your concerns, provide you answers, and be accountable to you. And we're going to make sure that every step of the way on this journey, you're up to speed and that you see real progress. So there's going to be some big steps taken in the coming days. Just a few days from now, you'll see labs and other things reestablished in Dauphin, and we're going to keep this going with the momentum that we're building. So thank you all so much for taking the time to be here, and just know that we may not have every single answer for you tonight, but we're going to endeavor to get you every answer that you need as quickly as possible. Thanks so much.
Thank you, Minister Asaguara. I'm now pleased to introduce Honorable Ron Kostyshin, Minister of Agriculture and MLA for Dauphin.
Well, good evening, everyone, and it's truly my pleasure to be here tonight. And I would like to acknowledge Minister Uzama, for making a trip up to Dauphin here and taking part in the town hall meeting. I think it's truly inspiring to have the minister here today and personally see the damage and destruction that has occurred in this hospital. Also, I'd like to acknowledge Prairie Mountain Health, Tarina Slate, a great job that the team has been tasked with, and along with her teammate that's here today. You know, it's truly one of the things that until you personally witness it and see the devastation that took place because of the flood, and being here today, I think really educates all of us as we are going through some challenging times. And I really appreciate the opportunity that we're having this town hall meeting, because often questions are never answered. And I think today is the time to ask the questions and get educated, because truly education, communication to straighten out the unknown facts is probably the best medication moving forward. And let's work together to make this over sooner than later. And we are very much appreciated of the communities such as Grandview Hospital, St. Rose Hospital, on all team that has been going out to those very locations to help us out during these challenging times, to provide the healthcare that we definitely need. And together, we can come together strong and have the hospital back into operation sooner than later. And I definitely want to thank all the medical professionals who previously are presently working in Dauphin and doing other work in accommodating the importance of healthcare in the province of Manitoba, more importantly in the Parkland district. So it is my pleasure to be here tonight and take part in the town hall meeting. So thank you all. And I'd like to acknowledge Mr. Dave Boziak as also will be joining us as well. Thank you. And thank you all for being here.
All right, thank you, Minister Kostyshin. It's now my pleasure to introduce His Worship Mayor David Boziak, the City of Dauphin. Go ahead, Mr. Boziak.
Thanks, Jeff. On behalf of the city and by extension the residents of the rural municipality, again, I want to shout out to Shared Health and Prairie Mountain Health and the health minister and our MLA for actually making this happen. I think information sharing is truly necessary and important. As we've talked to people in the community since this event happened, a lot of people were questioning what was going on, and the troubling part was when they didn't know what was going on, a lot of them were making stuff up. And so it's really wonderful to hear from the people that are in the trenches right now, to get a sense of what's going on. And I want to particularly, acknowledge the information that Prairie Mountain Health has been putting out, especially the pictures that were put out last week that truly show the devastation at the facility. I had I was there the day of the flood, and I saw people, primarily the Dauphin Medical Center staff and the Regional Health Center staff, basically setting up a command center across the road in the health building, managing the situation at that time. So we had patients that had to be transferred out of the hospital. There was no power. It was just basically a catastrophe. And I saw the tremendous effort, and it was a beehive of activity of people from the health center and the shared health folks, and there were the paramedics and the ambulance folks there. And it was truly phenomenal to witness that on the day of the flooding event. I also had the opportunity to tour the facility the next morning when the Premier was in town. Had my rubber boots on, was slogging through the water, and I saw for myself the devastation and knew that this was going to be a long recovery period. And that's one of the things that I'd like to share in tonight's meeting, is that the scale and scope of damage has been mentioned already, but it is absolutely unprecedented. And the various steps that must be taken to do assessments, to find out exactly what needs to be done, and then to figure out how to get that done are the processes that we're involved in right now. So I want to acknowledge and echo what the minister said and what Minister Kosteshin said about the province being there for us. And I can recall the Premier saying that morning that we have your back, and that this isn't going to be solved in a few days, but the province will not forget about you. And that's one thing that I truly want to appreciate. And I've had conversations with Minister Asagera, ongoing communications with Ron and his office staff and folks from the province. I've had ongoing communications with the Premier, and each time I've spoken to people, they've assured me that they will not forget about Dauphin. And I want a special shout out to Trina and the communication that she's been able to provide me with when I was asking her some pretty hard questions right out of the chute. And she was very open and very straightforward, and basically said, you know, explained all of the situations and said in very short order, this information will become much more available to the general public. And so that's what I'm really appreciative of, is this opportunity tonight, and the ongoing information sharing that we've been assured will occur from Paramount Health, from Shared Health in the province, as we work through this. So again, thanks very much for including me tonight, and the citizens of the City of Dauphin and the RM and the surrounding region. I'm very appreciative of all the efforts that everyone is involved with, because we know it's a big job. Thanks very much.
Thank you, Mayor Boziak. All right, I'd like to thank all of our dignitaries for bringing greetings this evening. At this time, it's my pleasure to introduce Trina Slate, the Chief Executive Officer for Prairie Mountain Health. Trina will be discussing program and service updates, restoration updates, and photos of the initial impact to the Dauphin Regional Health Center. Welcome, Trina.
Thank you, Jeff, and good evening, everyone. Thank you for taking the time to join us this evening for this important update. We will show some slides in the background as I speak that will demonstrate the flooding damage, but also to provide an update of the restoration activities. I initially toured the hospital several weeks ago, and during that time, rubber boots were required, still were today, but very much required a few weeks ago, where we were walking through inches of silt and mud. But today I could not believe how much cleaner the building looks. All of much clutter and removal of equipment, machinery, etc. has already occurred. It was just tremendous work that our restoration teams have been undergoing to get the facility cleaned to a place where we can start working on the restoration and recovery work. So just really very much appreciate that. Before I get started tonight, I just want to provide an update or express gratitude towards this community and something remarkable that we witnessed. On July 1st, as the floodwaters threatened the hospital and patient safety became our immediate priority, we witnessed the very best of Dauphin and the surrounding region. In a matter of hours, 54 patients were safely evacuated from the facility. And I will note, we didn't have elevators to do that. That effort was not only possible because of the extraordinary response from so many people who stepped forward to help. I want to sincerely thank our staff, physicians, emergency responders, municipal leaders, volunteers, and partner organizations who worked tirelessly during a very challenging and emotional day. I especially want to acknowledge the members of the local fire departments who played a critical role in helping move patients safely, and the local farmers and equipment operators who answered the call for help and brought in machinery to navigate the flood conditions. Many of those individuals dropped what they were doing on a holiday and came together without hesitation to support neighbors. The evacuation was a tremendous team effort, and because of that effort, every patient was transferred safely and continued to receive the care they needed. As difficult as this event has been, it has also demonstrated something very important. When our community faces a challenge, we come together. That spirit of collaboration, generosity, and resilience continues to guide us as we work towards recovery. I know the past few weeks have been incredibly difficult for our staff, physicians, patients, families, and the entire Dauphin community and the surrounding area. Our regional hospital is an essential part of this community and the entire surrounding area, and we recognize the disruption and uncertainty of the flood has created. So our progress today, the positive news, as we talked about, there's been significant damage to our building and the critical infrastructure that is really the heart and lungs of this large building that was so important to all of us. Healthcare facilities are highly complex buildings requiring an incredible amount of power. Recovery involves much more than cleaning and drying spaces. It includes extensive assessment, testing, repair, replacement, and certification of systems so that patients can depend on safe care. The positive news is that substantial work is already underway. Teams of engineers, contractors, architects, clinical leaders, shared health, Prairie Mountain Health staff, and government partners are working together and pushing each other every day on rebuilding efforts. Detailed assessments are being completed, identifying the required equipment repairs, replacements to support the eventual restoration of services. All teams are working with a sense of urgency, recognizing the need to reestablish services in the hospital as soon as possible. At the same time, we're not standing still while the facility work continues. We are focusing on ensuring the people of Dauphin and the surrounding communities continue to have access to healthcare services. Teams are actively exploring and implementing temporary solutions that can support patient care while the hospital recovery proceeds. Spaces are being reviewed for hemodialysis, chemotherapy, and diagnostic services as a priority. And in the coming weeks, we will have the starting dates of those services.
Yeah. Hey, Trina. Sorry, I think we're getting some feedback on your communication. I just wonder if everybody else can hear that.
Yes, I agree, Minister. Trina, can you go ahead just so we can check again? Yeah, no, we got very much feedback, Trina, on your all of a sudden you got most of the way through. In the last probably 20 seconds, it's been bad feedback. So we'll see if IT can come and help for 1 second. Just give us a moment, please, folks. We're going to see if we can correct the sound issue for Trina's microphone. Apologies for the interruption.
Can you hear me okay now?
Yes, that's much better, Trina.
So sorry about that. I'm not sure what happened. I really didn't move.
That's all right. You're off camera. If you wanted to go back on, it's up to you.
Thank you. I want to thank the community for its patience, support, and understanding through this difficult time. The concern people have shown for the hospital, for our hospital, demonstrates just how important healthcare is in our region. While this is not where any of us expected to be, I remain hopeful. We have talented people working on recovery, and we have strong partnerships across healthcare system, government, and the community. Most importantly, we have a shared commitment and sense of urgency to restoring services in Dauphin and the surrounding area as soon as possible. Recovery will take time, but progress is being made every day. Our goal is not to simply reopen the facility, but restore a safe, reliable healthcare environment that will serve the community for many years to come. Thank you.
All right, thank you, Trina, for providing this important update. As I mentioned earlier, we'll have time for questions following all the presentations. We'll extend the time. I know we started a bit late, so we'll be extending the time of the question period as well. So please enter any of the questions you have into the question pane on the GoToWebinar platform, and we'll get to as many as we can later on. All right, so at this time, it's my pleasure to introduce Dr. Chris Christodoulou, Interim President and Chief Executive Officer of Shared Health. Dr. Christodoulou will be discussing the collaboration of the health system in responding to the flood and provide diagnostic and emergency response services updates. Welcome, Dr. Christodoulou.
Good evening, everyone, and thank you for joining us this evening. I want to begin by acknowledging the strength of the people of Dauphin and the surrounding communities. The past several weeks have been incredibly challenging, and we recognize the uncertainty, disruption, and stress many individuals and families have experienced both in their personal and professional lives. At the same time, we have seen something truly remarkable: neighbors helping neighbors, organizations working together, and people stepping up to support one another. Across Shared Health, we have been inspired by that spirit, and it guides our work every day as we focus on providing the important health services that you require and need for your and personal and family safety. Thank you for your patience and understanding and flexibility as we continue to work through this very difficult situation. We know changes to where and how care is delivered is very difficult. Every decision we have made has been guided by one priority: ensuring that our patients continue to receive safe, high quality care while we restore services as quickly as possible. I want to take a moment to recognize the incredible efforts of our healthcare staff within the Prairie Mountain region, but also across the province of Manitoba. To our Prairie Mountain Health colleagues and those in the Parkland region, our Shared Health teams and partners across the health system, thank you. Over the past several weeks, staff have adapted quickly, worked through challenging circumstances, and remained focused on what matters most: caring for patients and supporting the communities you all call home. When the flooding situation escalated in Dauphin, the provincial health system came together quickly to coordinate a complex response, working together with health system leaders, our government of Manitoba, regional health authorities, emergency responders, and community partners to support patients, align resources, and respond to rapidly changing circumstances. This included the safe evacuation of 54 patients, as Trina has mentioned, from the Dauphin Regional Health Centre. Since July the 1st, teams across the health system have continued meeting regularly to respond to new challenges, adjust plans as needed, and prepare for restoration and recovery work. While that coordination has been happening at the provincial level, working with partners across the province, teams across Shared Health have been working around the clock to maintain access to care. This includes emergency response services, diagnostic services, kidney health, and many provincial clinical programs, including surgery, emergency medicine, women's health, cancer care, mental health and addictions, and community and seniors care. Restoring services closer to home. As this situation continues to evolve, our focus is shifting fundamentally towards restoring services and expanding care options closer to home wherever possible. Tonight, I want to focus on two areas that I know are important to this community: diagnostic services and dialysis. I will also be happy to answer any questions about other services during our discussion. Following the closure of the hospital, our diagnostic services teams acted quickly to minimize disruption for patients. Every patient with a scheduled diagnostic appointment was contacted directly, and appointments were rebooked at alternate locations based on the service required. This included CT scans, MRI, and ultrasound studies at locations including Brandon, Roblin, Portage la Prairie, Winnipeg. Transportation support has been provided where needed to help patients access these important services. We know how important it is for residents to receive care closer to home. A temporary outpatient diagnostic clinic will be opening in the coming weeks. This clinic will restore access to several important diagnostic services within the Dauphin community, while longer-term recovery work continues. Services will include blood work, X-ray studies, EKGs or electrocardiograms, more commonly known. This will help reduce travel outside the community for many routine diagnostic tests while maintaining timely access to care. We have also expanded our ultrasound services to 5 days per week from the previous 2 days. Dialysis services. From the beginning, our priority has been ensuring uninterrupted access to life-sustaining dialysis treatment. No dialysis treatments have been cancelled as a result of the flood and the impacts to the Dauphin Regional Health Centre. While patients have experienced changes to treatment locations, care teams work diligently with every patient to arrange alternate care and provide transportation support where needed. Patients continue to receive dialysis through alternate sites across the region and province. Additional capacity was created through collaboration with partner sites to ensure continuation of the care. We remain committed to minimizing disruption for patients and their families throughout this transition, and we also recognize how important it is to restore dialysis services closer to home and within the community. Work is underway to assess options for a temporary dialysis location that can safely support the specialized service. While we do not have a confirmed timeline to share today, patients will be updated as soon as more information becomes available. Until then, our focus remains on providing safe, reliable, and high-quality dialysis care for every patient. In closing, as we move forward together, please know that we remain deeply committed to restoring services as quickly, safely, and effectively as possible. Thank you again for your patience, understanding, and partnership throughout this recovery. I know many of you have questions, so Jeff, I will turn it over to you so that we can move into tonight's question and answer session. Thank you.
All right, thanks for that update, Dr. Christodoulou. All right, so we've now reached the time for our question and answers. As a reminder, any question that we do not get to live will be answered either directly or posted to our website. Please submit your question in the question pane. Your questions and name will not be shown on your screen. Okay. All right, so we are joined by Minister Asaguara, as well as several individuals from both Prairie Mountain Health and Shared Health who can see on the screen and the slide who fielded questions for the respective areas. We want to thank all the individuals who have joined us today for the town hall. So the way I'd like to handle these questions is I could call on Prairie Mountain Health's CEO, Trina Slade. I will read out the question, and if you could act as a quarterback, Trina, that would be helpful, and then we can get through as many as we can. I think that's the plan. So I'll start with the first question. Is Dauphin Hospital fixable?
Well, in absence of a building expert, I will take that question. So we have been reassured by the engineering experts involved in the building assessment and procurement of equipment to reestablish electrical and mechanical service back to the building, that the building is sound. The basement structure is brick, concrete, steel. There will be water testing done and removing any water damaged materials such as drywall up to and above a level of water damage, and of course building back better than it was to ensure that we will sustain building integrity over the long term and into the future.
Thank you for that, Trina. All right, I'll move on to the second question. Another short one, but a good one. When will a dialysis center be opened?
Okay, I wonder, I think I'll start and then I'll ask others to join as they are able. What I know is that there are, the specialty clinical teams are involved in exploring where dialysis can be located, either within Dauphin itself or in surrounding areas, based on the clinical parameters that are required by that program to provide safe care. And ensuring that patients can be treated as close to home as possible. We are hopeful that we will be able to establish dialysis services back or near to Dauphin in the coming months. I don't have a firm timeline on that because there is still exploration being done on spaces and services available and accessible.
Does anyone have anything to add to that answer to Trina's?
Certainly, maybe what I would add, and thank you, Trina, for taking that, is that we have been having conversations with different First Nations. So I want to thank Chief Neepanak and Grand Chief Kyra Wilson. There's a number of folks we've been in conversations with, as well as municipal leaders and folks who have made very clear that for good reason this is a priority. And so everyone recognizes the urgency around this. We want for dialysis patients to get care as close to home as possible. And so everyone is working as quickly as they can to identify what the best path forward on that is. We are hoping that in the next conversation that we have with you folks, that we will be able to provide you some more concrete timelines regarding what will happen with that care and it being reestablished. But there's obviously a level of urgency to this. And, dialysis patients are continuing to get that care, of course, but we do want to make sure they get it as close to home as possible. So that is going to remain a top priority in how this work moves ahead.
Thanks, Minister Asawara. All right, I'll move on to the next question. The next question says, who has confirmed point of care testing will be available at the temporary location?
Perhaps I can ask Dr. Socorro to start with that. Thank you.
Thank you. That's a good question. I can confirm that the point of care testing will be available at the patient service center for the diagnostics that will be open. And our intention is to be able to provide that so that patients do not have to go to other communities for that kind of testing. Thank you.
Thanks, Abdi. Anyone else, anything else to add for that one? All right, I'll move on to the next question. I think this is an extension of someone's report earlier, but the question is, does that also include X-ray opening at the end of next week?
Who wants to take? Go ahead,
Yeah,
Dr.
thank you.
Socorro.
I would say that is our intention, that we get that operational as fully as possible by the end of next week.
Excellent. All right, I'm going to move down. Okay, it's a little bit of a longer question, so bear with me. Can you provide a timeline for the return of emergency services provided in the ER? Lab, X-ray, CT, and MRI. Also, will dialysis and chemo be back in Dauphin?
Thank you for that question. This is a top priority for us. We've heard we've prioritized this from the beginning. That as we indicated, emergency room services, diagnostic services combined together at the same time need to be the top priority for services that we reestablish in Dauphin as soon as possible, back in the hospital. What we are looking at as a priority before we can get back into the hospital is looking at community-based services as we discussed, prioritizing those to be reestablished. We do not have a timeline on the moving back into the hospital, as we indicated, because that's depending on procurement of electrical and mechanical equipment to reestablish HVAC systems and electrical systems in the building. However, what we can say is that we are working towards hemodialysis and chemotherapy oncology treatments as close to home as possible in the coming weeks and months. I will say that many cancer care related services are already being provided in Dauphin, with family physicians providing follow-up appointments within their clinics already in Dauphin, and some treatments that can be provided in the physician clinic or the outpatient department based in the community health services building are already being offered. So I really commend the teams to working towards that fast action to ensure that people are being treated in Dauphin now.
Thank you, Trina. Does any other panelists have anything to add?
Yeah, maybe what I would add to that, I think Trina did a great job capturing that, and I neglected to give a shout out to Dr. Socorro as well, who gets a lot of feedback from myself and my office, a lot of questions, why this, why not faster, and he's been really responsive and is actually just a great team player in terms of keeping his foot on the gas and working with us to move things along more quickly, including reestablishing lab services and X-ray and everything else. So I want to thank you, Dr. Socorro, for being so wonderful to work with in that way, and we're going to keep working together to move things as quickly as we can. I want to thank the team that we met today, Shelley and her team, who have gotten really creative about the utilization of space and have, as a result, been able to provide some cancer care services to patients in a pretty novel way. So kudos to them. I would say that in terms of reestablishing emergency department services, every single option is on the table for us. Of course, we want to restore services in the hospital. That's everybody's goal, but we recognize the magnitude of the damage, and certainly what we saw today, the complexity of that damage requires all of these different systems and structures working together and moving that as quickly as we can. We recognize that everyone's best efforts are there, certainly, but we know we have to think outside the box. And so I just want folks to know transparently that we are looking at different options. Perhaps it's modular, perhaps it's another location. We are very open to doing what is necessary to reestablish services in Dauphin. And so I want to thank some physicians that we've been hearing from, and we're going to continue to listen to and work with moving forward. Dr. Malik, Dr. Fusted, there's a number of other physicians who have brought forward ideas, concepts from other jurisdictions. Our government, my deputy, they've been in touch with, we've been in touch rather with other jurisdictions across Canada, Ontario, Alberta. We've been in contact with jurisdictions in the United States. We're looking internationally to see what options are available to us. What do we have to do here in Manitoba that's maybe never been done before? So I just want folks to know that we are looking at every option available to us. We're exploring and investigating every idea that's brought forward by your wonderful doctors and care providers. And our goal here is to stand up these services in a safe way, but as quickly as we can for folks.
Thank you, Minister. All right, so another interesting question here. We know that St. Rose is open to 24 hours now. This question is there any capacity to send more staff to Grandview to increase the facility to 24 hours? We know that facility is only at 12. So that's the question.
Yeah, thank you for that question. It would be, in an ideal world, absolutely. We would have both of those sites and others in rural Manitoba open, extending ER hours to the extent possible. We know that to do that, we need the recipe of lab services, nursing services, physician services. We are really challenged to have enough human resource to allocate to every service that we require right now, and it's required us to really prioritize and to focus on, St. Rose was sort of the chosen option at the time due to road closure between Dauphin and Grandview, which led us to that quick decision to support St. Rose. But absolutely, if in the future it looks like we can do that from a human resource perspective, we absolutely will. And constantly we are reevaluating, reorganizing, and we can't thank our staff enough for their willingness to support these services as we move forward and adjust to the needs that are presenting, in the community, and also based on, what's required as we move forward through this. So I just really appreciate everyone's flexibility and willingness to work with us and support patient care. Everyone is keeping patients and the public at the center of their thoughts as we move through this. So thank you.
Thank you, Trina.
Trina, I might pop in here as well. My name is Kyle Conrad, Associate Chief Medical Officer in Prairie Mountain Health, and working closely with all the physicians, both in the parkland and around the region in Prairie Mountain Health. Another part of our jobs is to look after each other. And our goal is to ensure that people are here not just now, but going forward. We want to protect our care providers. We want to ensure that people are healthy and well to provide high quality care for a long time to come. And that includes over this next year and beyond, and when we're able to fully reestablish services within Dauphin Regional Health Center. And so, as Trina alluded to, there is only so many of us to go around, and we got to make sure that that we are providing those services to the maximum of our ability, but also ensuring those services are there for a long time to come. And so as things evolve and as things change, different options may become available, but we do need to make sure that we also keep the safety of our providers in our lens and ensure that they are here for many years to come. Thank you.
Thank you, Dr. Conrad. Very good point, well taken. All right, I got another question that we've heard before. This is more about what are some of the options. So before the hospital building can be back in use, was there an option for temporary care areas such as a mobile emergency room, maternity care, obstetrics, etc.? I'm sure someone on the panel can answer this one.
Well, I'll start, and I'm sure, Minister, you'd like to join, but I think we've spoken to the efforts, to Minister's earlier points, and I've said this before. No stone is unturned. We're evaluating every potential solution when it comes to mobile or modular options that might exist, either to expand existing service in facilities or to look at what can be provided with in situ, in place. So very much looking at all of those options. And also we would be really looking forward to understanding better what might be possible as in the hospital, around can we provide service in a portion of the hospital while we're waiting for the rest of it to be functional. So waiting for those evaluations and assessments to inform that decision making as we move forward. But Minister, you might have more to add there. Thank you.
Thanks, Trina.
Well, I think you really you covered a lot of really important points there, Trina. And ultimately, and I've shared this with folks before, certainly in our last conversation, and I think I shared it with physicians earlier today and team members. Our goal here is to, as quickly as we possibly can, stand up as much of the services that were being provided at Dauphin Health Center at the hospital in Dauphin. We're not talking about, the full rebuild better of the hospital. We're going to do that too, right? We're going to restore all of those services in full and better. But what we need to do in the immediate is make sure that we are standing up the equivalent services in Dauphin as quickly as we can. And that is our goal. And we are going to do that. And we're working to do that in the immediate, step by step. Whether that's the provincial buildings and the infrastructure that we have that exists already, modular and mobile options. We are looking at every single one of those options and putting that all together so that in short order, you've got the equivalent comparable services that you had previously in Dauphin. That is the goal. And we recognize that our friends in other communities, Grandview, St. Rose, other places that are doing so much, we can't thank them enough for how quickly they responded They're absolute team players. They are willing and so engaged in making sure that folks are getting the care that they need. We recognize that's going to need to be in place for some time, and we're going to continue to make sure that they have what they need to deliver the best care. But we also know that in the immediate, we need to have services in Dauphin. And so we're doing everything we can to make sure that we're doing just that. And the engineers and clinicians and all of these experts, we're bringing in additional experts who have worked in disaster response specific to healthcare. We're bringing that expertise in to make sure that every single thing we can possibly do is being done. And our government is backing all of that with the resource required. It is going to stay a top priority. We are going to put real resources behind it every step of the way. And you can trust that we're walking hand in hand with everybody who's a part of this to make sure that sooner than later, again, we're working to do this in the immediate, that you've got those services right here in Dauphin. That's our priority.
Thanks, Minister. And just to add, there's been lots of questions about field hospitals. And if I'm hearing this right, just confirming nothing's off the table. We're looking at everything possible to restore services. So in terms of field hospitals, I would suspect the answer is the same, correct?
Absolutely. We've explored that. We actually explored that option immediately. We asked Canada for help on that front. They actually had already, Dr. Conrad knows who, I can't emphasize how awesome Dr. Conrad is. I can't. This is a person who genuinely just, the emotional intelligence, the awareness, the care for people who provide care to others, system understanding and expertise is just through the roof. So you folks have a tremendous advocate and leader in him, and I can't thank you enough, Dr. Conrad, for all of your work. The field hospital model was something that we looked at right away. We actually, at that time, thought Canada had an option that perhaps we could use, and unfortunately, they already divested of that. They got rid of that some years ago after COVID. So that wasn't an option, but we are absolutely looking at any and all field hospital options, modular, mobile. We're looking at all of that, recognizing obviously we also are looking to winter. We need to make sure that any option we stand up can withstand and keep people comfortable and safe in our winters. So all of that is being explored, absolutely. And again, our government will resource what we can achieve here. Our priority is making sure it's done as quickly as possible. And we're working with your doctors because the ideas and the feedback that we get need to be validated by your physicians and your experts on the ground who deliver this care. So we're going to work as a team on this every single step of the way.
Thank you, Minister. This is another question that I had initially, so I'll ask this one as well. It was, what is happening with the PCH, as they would have had some issues as well? Question mark.
Yes, thanks for that question. So yes, the PCH did experience some challenges with their HVAC, impacting their air conditioning. We expect that to be fixed actually this week. If it wasn't fixed today, we were in that building and it was cool, but it wasn't clear if that was coming from room air conditioning or from centralized air conditioning. So we believe that is either fixed or near to being fixed this week. Thank you.
Thanks, Trina. Going back to services, there's a question here about the mobile CT and where it will be located. Question, would it be in St. Rose Emerge?
Thanks. I think maybe Dr. Socorro, don't know if you want to take that. I don't know if it's yet been determined location. However, it is definitely looking like the feasibility might be most appropriate attached to a facility, but I will let Dr. Socorro speak. Thank you.
Thank you, Trina. You're right. We have not determined that. We are working with our clinical partners to ensure that we put it where it is really appropriate, given the fact that a CT alone it needs to be taken into the consideration of what other clinical services are available as well. So we will know what the answer to that question is in the coming weeks or so. As we determine where the clinical services are going to be stood up. It is important, though, to mention that the CT is important for it to be not a standalone, but to be connected to a building so that it is able to provide both services for the inpatients and patients that are walk-ins from home who are coming on an elective appointments. Thank you.
Thanks, Abdi. This one here is about, this one says, it's my understanding this will be a blood draw only site with no actual testing being done in Dauphin. I'm assuming they're referring to the clinic.
Yes, Jeff, I can take that. I think that is not what we are planning for. What we are planning for is a blood draw and some point of care testing. It will not be a full lab like the Dauphin Hospital lab was, which did a lot more things than it did, but there will be basic lab testing on the point of care device, which serves all of the needs of a primary care, but also in an urgent care scenario as well. It will also provide ambulatory EKG, which means people can get their EKGs done as long as they don't have symptoms, chest symptoms, because the patient service center will not be attached to an emergency department or an urgent care. It will also be able to provide X-ray services as well. And so those are the services that we intend to provide, not just phlebotomy alone. Thank you.
Thanks, Abdi. This question resonates with me from a disaster management point of view, which is mitigation and preparedness. And the direct question is there a plan to protect the hospital so this should never be able to happen again?
I can start that. Absolutely, it is top of mind to, as we move through the restoration process. It is already on our project leads list to consider that very question around future-proofing this building so that it lasts well into the future and that we never again experience a disaster to this extent to our hospital. I wonder if I may ask Mayor Boziak to speak further to this question.
Yeah, sure, Trina. I know that the city is working with the provincial government, Department of Infrastructure, and also with emergency management, the emergency measures folks, to try and give us a little bit more of a heads up. It's a provincial responsibility in terms of monitoring the river levels, and we found out that actually the Vermilion River Monitoring Station is downriver from the city of Dauphin, and we need to get some information upriver where we know that water comes out really fast because of the elevation, but we could still get a 24 to 48 hour heads up. Our public works folks on the night of the event at about 10:30 still reported that the water in the Vermilion River was high, but they didn't think it would be catastrophic. About 2 hours later, it was. And what's interesting is as we're monitoring water levels in the community and in the river, the Vermilion Reservoir, which sits just on the edge of Riding Mountain National Park, didn't breach its banks. And so water got into the Vermilion River system somewhere a little bit north of the Vermilion River Reservoir. We understand, we've talked to a few folks who said they had anywhere from 6 to 10 inches of rain in their rain gauges in the Keld area and on areas that may help get water into the Vermilion River system. We also understand that there was a lot of debris in the river, trees and things that caused a little bit of a backup at both the CN rail bridge in the city and the 4th Avenue bridge, which is right adjacent to the hospital location. So we think, we're not absolutely certain, but that the water breached the east banks of the Vermilion River, just a little bit south of the ambulance garage, and came overland, infiltrated the crawl space in the personal care home, and also made its way probably over the parking lot. But we have pictures from our fire department staff from early in the morning when the event was occurring, and water was coming out of the loading dock area of the hospital into the ramp area. So we're still not absolutely certain where the water came from, and so we've been talking with the province about some mitigation strategies in the future. Might that be a bit of a minor diversion, either into Salt Creek, which would be west of the community? We don't know if any more water can go that direction, or a connection to the Edwards Creek diked system, which all the water ends up in Lake Dauphin eventually, but it might go around the city. We also are aware that the Vermilion River, most of the flooding was over the eastern bank of the Vermilion River into the city and not over the western bank. So there may be an opportunity to raise the eastern bank of the Vermilion and keep the high water flowing through the city and not going over its banks. And then finally, just to give you a context, and I know Minister Asagera explained how much water was in the basement of the hospital based on its square footage, but our water services folks were saying that on a typical day, Dauphin handles in its water system about 3,500 cubic liters of water, and that's water coming into the system and from our lift station leaving the community on a typical day. So an average volume of water in our system is about 3,500 cubic liters. On the day of the flood, we had 3,500 cubic liters entering the system, and we had 47,000 cubic liters trying to get out of the system. And that was with our lift stations all going full capacity and 3 additional external pumps trying to get rid of the water. So we're not certain where the Vermilion River gained all of that volume of water in such a short period of time, because as I mentioned, the reservoir didn't breach its banks. So the reservoir in the park still had almost 2 meters of capacity before the water was over the banks there. So interesting, but we're working with the province on that. We're working with our neighboring municipalities because we can't push more water into other municipalities. So those discussions will be ongoing, and we have already started our debrief on our emergency management response, and we'll be working with the Emergency Measures Organization and infrastructure going forward to figure out how we handle this in the future.
Thank you, Mayor Boziak. Lots of good conversation, a lot of good questions. We're going to extend this to 8 o'clock to try to get through some more of these questions, because it's very important that we get through as many as we can. Rest assured, we will answer them all in due course, but we'll extend till 8. So I'll throw up a few more for everyone. The next one is a lab question. Is there an option to use Winnipegosis as they do lab work?
Thank you, Jeff. That's a good question. I would say all options are on the table. We are exploring all options, and we will be able to do Winnipegosis if we know that we can provide that services in a safe manner. The biggest challenge right now is not the lab space in Winnipegosis. The biggest challenge is staff, because we have staff spread over from Dauphin into St. Rose and other locations. We need to make sure that we can provide that service with this current complement of staffing that we have. But having said that, it's all options on the table that we're assessing. Thank you.
Thanks, Abdi. All right, and here's a question around specialty physicians. What is the strategy to keep specialty physicians and staff in the region?
I'll start, and I'll probably lean on Minister and Dr. Conrad to add here, but retention of all of our staff and physicians is paramount. As we move through this, we know how distressing, well, we don't know because we've not lived it, but we can acknowledge and recognize how distressing and disruptive this has been to personal lives of our providers and our staff. Our hearts are with them. We want to do whatever we can to retain our staff and our physicians as we move through this, and we are doing whatever we can to provide work in alternate locations in a stable format so that they can live their lives. Doing our best to listen and understand their needs as we move forward through this. And Dr. Conrad and Minister, I would ask you to add more, please. Thank you.
Thank you for this. So very important that people are able to maintain continuity with the patients that they care about so much. You know, loud and clear from the interprofessional group of care providers and staff is the need to continue looking after the people. And so there's been opportunities that we have worked very diligently on day and night to develop in terms of operating room access to care and supporting the providers to provide this in alternate locations. In terms of obstetrical care that immediately went into swing with the use of Nipawa and Brandon Regional Health Center and supporting patient flow this way. And then our anesthesia providers as well, helping out both in a critical care capacity locally and then also providing anesthesia care in places like Brandon, Nipawa, Swan River, Minnedosa. So there's certainly no shortage of work to go around, but also important for you to know that you're also being looked after by your same care providers that you've developed your relationships with, your trust with. It just may be in a slightly different spot for a while before we get back. I also want to acknowledge the physician assistants and the work that has been done. So with immediate relocation to help support the patients who were displaced into Brandon, for example, and things like that. And so healthcare is a team sport. It's an interprofessional approach that we need all hands on deck, and we need everyone. And so from physicians to all of our interprofessional colleagues, occupational therapy, physiotherapy, dietitians, all of the multiple folks that we need to look after people well and holistically are being engaged in this process. And as I said earlier, we need to look after each other and ensure that we have safe access to care and that people are well for a long time. So we have lots of work, and we certainly are ensuring that continuity of care also.
Thank you, Kyle. Anything to add, Minister?
Yeah, I think that Trina and Dr. Connor did a great job covering that, and it's a really important question. I would just echo what they've already stated. We plan on retaining everyone. Our priority is retention, and continuing to recruit. That is our priority. We recognize how invaluable these providers are, and it's over the last many years that people have worked really, really hard to develop the healthcare teams that exist in Dauphin. And these are top-notch teams and providers. And we want to make sure that we keep them in the region, providing care to folks in the Parkland. And, part of how we retain folks is by listening to them, listening to what they have to say, actioning their ideas. And I can tell you that everybody on this call is committed to doing just that, have been listening and is committed to doing that and working with your providers as we move forward. I want to give a shout out to the doctors we met today. There were some radiologists who provided some really clear feedback and ideas that we can take away in action very, very quickly to make their lives a little bit easier, to make sure they're able to continue to provide care to their patients, to make sure that they have work they can depend on. And these are really common sense, practical ideas they're bringing forward. They just need a little bit of help from government and from partners to move it along for them. And so this is really how we're going to get things done. This is how we're going to retain doctors and providers. It's by listening to these experts who know what they're talking about when it comes to providing care in the best ways possible and are very willing to think outside the box. And by working together to get these things actioned and to move obstacles out of the way. And I also want to recognize a couple of providers, a couple of health service managers, nurses who handed me a letter today in our meeting. So Carla, and I believe Chandel as well is on this letter, but brought forward some really great recommendations that are going to make it easier if they get a bit more support, make it easier to manage the scheduling of these specialists, make it easier for them to focus on doing what it is they need to do. Everyone has stepped up in this emergency. Everybody has stepped up to do as much as they can. And it's so important for us to step up and step in and offer more support where folks are putting their hand up to say, I'm doing my best, but I need just a little bit of help to do this the right way. And that's why we're here. So I just want to thank the folks who have brought great ideas forward, who put this letter in my hand today. I've gone over it. The deputy's gone over it. We're taking this away. We're going to come back with actions really, really quickly. We want you folks to know that when you're courageous enough to put your hand up and bring ideas forward, that we can take actions together. And that's how we're going to retain and attract through this challenge that we're facing. And you've got some wonderful leaders who are on this call, and many, many other folks and teams who are doing this work around the clock to support you folks.
Thank you,
I
Minister.
just wanted to tag on to that as well, just with regards to recruitment to retention. As care providers, we're also teachers. And Dauphin Regional Health Center and the wonderful interprofessional folks there have been leaders in education and medical education, nursing education, physician assistant education, etc., for many years. And there's a residency program as well there in Dauphin. And so, very quickly we were able to connect with folks from the university, with the residency program and locally folks. And so people chose to do residency programs in rural Manitoba, and rural and northern Manitoba are important to be represented in our educational systems. And so we have opportunities for learners to remain attached to Dauphin Regional Health Center and the wonderful providers that are there. So there is still the ability to develop our next generation of providers locally in Dauphin, in the surrounding communities, and what a learning opportunity in these times. And through some of these tragedies, there's also wonderful learning opportunities and development opportunities, and this is an amazing time to be a learner in our medical education. As we go through fires and we go through floods and we go through everything else, wind and rain. And so, what a time to be a learner in our educational system. And that is front and foremost with us, as I've done a lot of work advocating for rural and northern Manitoba and representation in our educational systems as well. And I just really wanted to ensure that students are there as well.
Thank you, Dr. Conrad. Your words are inspiring. Great message. Before I go to the next question, I did right off the hot press from our comms team, just a note for everyone that we're getting a lot of questions or specific questions involving unique staffing situations and personal health, and just to know that we will be emailing responses on those directly, just as a note. Moving to the next question, what about acute psychiatry services? How are you prioritizing reopening 10 acute care inpatient psychiatry beds located in the Dauphin Regional Health Center?
Thank you for that question. Very good question. It was actually top of our mind thinking about, okay, what programs in the Dauphin Regional Health Center don't need the clinical aspects of the building, and psychiatry, of course, came to mind. Psychiatry, though, especially acute psychiatry, does need a specialized environment. And so it is top of mind for us. We did have 10 active beds in the Dauphin Regional Health Center for acute psychiatry. We have considered what might be possible in terms of crisis stabilization in a community-based setting, and things like that. I can say that through our provincial patient flow system, we are closely monitoring the impact of the psychiatry beds in the system, and the capacity of the system to support patients who require and will flex accordingly. But we will absolutely be looking at whatever options might present in terms of either a crisis stabilization unit or acute psychiatry. Thank you for that question.
Thank you, Trina.
Just to tag on to that, the community psychiatrist as well is still providing service in community, is helping support acute psychiatric needs in surrounding communities as well, around the clock. And so the access to that expertise remains, and we will work very diligently to ensure that those inpatient services are available as soon as we are able to as well.
Thank you, Kyle. I should have also mentioned that we have a robust community-based mental health programming in Prairie Mountain Health in the Dauphin area. Our staff who work on those programs are highly dedicated people who are working with our government partners around looking at what we can do to sort of expand those services. within this time of crisis, our nurses and staff who worked in our inpatient psychiatry unit have gone on to support other places within within our region where there was need. So St. Rose Emergency Department, namely, providing that really important support for people who are presenting with acute psychiatric problems. And so that's just been a tremendous benefit to that site. We heard today when we visited St. Rose how much that service is valued, and that support is very much appreciated. Thank you.
Thank you, Trina. All right, here's another question. How are you ensuring that people in the community have emergency services in Dauphin or as close to Dauphin as possible?
Jason, I'm wondering if I can turn to you to speak to ERS response, please. Thank you. As a starting point to that. Thank you.
You bet. Thank you for the question. Yeah, I can advise that emergency medical services are available to respond to all 911 calls in the Dauphin area. Furthermore, we've been working with a couple of our partners in emergency response services, namely Patient Transport Services, who is our contracted low acuity inter-facility transportation service in the province of Manitoba. And they have repositioned one of their vehicles into St. Rose at this time. And also we've worked with our other partner, STARS Air Ambulance, and we have temporarily repositioned STARS helicopter into the Brandon area. So we have more coverage in the Westman area at this time.
Thank you, Jason. Anything to add from the panelists? Other panelists?
No, other than just to say that, of course, the emergency room services were quickly stood up with our partner through the Roseau Compassion Network, which is St. Rose Hospital, which is not a Prairie Mountain Health site, I will point out. And we very much appreciate that partnership. We consider them part of us, but we just really appreciate that site's support through this difficult time. So standing up service at that site for 24/7 service, and the willingness of staff to embrace that quickly and respond quickly to provide that service to patients was just tremendous to see. Thank you.
Thanks, Trina. This next one is not a question, but I'm going to read it anyway because I think we have some solid answers for it. And it's just the comment, there hasn't been much discussion about mental health. We know that these types of incidents obviously affect many of the people that respond, that are providing care, having to be repositioned. So can someone please speak to the mental health work that's been going on to support this incident?
Very good question. And, you know, I personally feel we've absolutely acknowledged this need and recognize that we need to apply a more concerted effort. Dr. Chris Christodoulou and I were speaking about this today and thinking about how the shared health wellness team could better support staff in a more proactive way. We have those services are always available to our staff and also through our employee benefits program. But we feel we could be doing more to promote that service in a more sort of applied way so that it's offered in the form of presentation and just information on grief and loss that people might be experiencing during this time, and support for those emotions and feelings and experiences. We recognize, I think Minister mentioned earlier, that staff are also experiencing the loss of their own property during this really challenging time, on top of disruption to their work life and their place of work. And so we very much acknowledge that and want to do our best to support people. So we really want to listen to our staff in that regard and hear what they have to say in terms of suggestions on how they feel they would like support. But we know that we need to be a little bit more assertive in offering those supports as well.
Thank you, Trina. Anyone else on the panel want to speak to mental health?
Yeah, I thank you, Trina, so much for those comments, and thank you for whoever put that question in the chat. Just a really astute point to raise. And you know, my background is in mental health. I'm a registered psychiatric nurse, so I'll say here that mental health and the impacts of this event on folks has really been weighing on me quite heavily. Just thinking about how this has affected people and meeting with folks today who are showing up and have shown up every day for their patients and for their community while navigating their own personal loss and their own personal emergency and circumstances. It's just, well, overwhelming what people have been navigating and have been really basically heroic in showing up every single day for their patients and for their teams. And I know I've always said this to folks, doesn't matter where I go, I always say that we have the best healthcare workers in the country right here in Manitoba. And I always make a special point of saying we have the best healthcare workers in the country in rural communities in Manitoba. And we are seeing that for sure, folks who have risen to this challenge. But to Trina's point, we also know that we have to take care of the people who take care of us. And we must meet these folks who have risen to this challenge with the right supports in the right ways at the right times in the right places. And that's our objective. So I do want people to know that if you have ideas around what we can do more of or differently to support your mental health, bring those ideas forward. Our government is committed to making sure that you have what you need in order to be as well as possible. And we all know that, after an emergency, when you're in the thick of it, adrenaline's going, everybody's, diving in and doing their best. And then after some time, the effects of everything can really catch up with people. And we want to make sure that you have every resource at your fingertips. You know who to call, you know where to turn to, you've got someone in your corner. And we also know we have to be willing to be flexible about what that looks like. So if you have thoughts on that, bring it to Trina, bring it to your leaders, bring it to us, and we are going to make sure that we resource that and support you so you can be well.
Thank you, Minister Asaguara. All right, so I'd like to thank everyone for their questions today. If you have any further questions, please feel free to email us at communications@pmh-mb.ca. We encourage everyone to continue to visit the Prairie Mountain Health Dauphin Regional Health Center Services Updates webpage. The link can be seen on the screen here and found throughout the homepage of the website. Any questions we did not have a chance to answer today will be shared on this webpage. And as I stated earlier, others will be reached out to directly via their email, and we will leave no question unanswered. So with that, I want to give last words to Minister Asaguara, and we can wrap this up for today, and really appreciate everybody's time and questions. Thank you.
That's kind of you, Jeff. Thank you so much. It doesn't feel necessarily right for me to have the last word. We've got some phenomenal people who have really contributed to this. I do want to thank all of the folks on the team at Prairie Mountain who have come together to make this town hall possible. There's a whole lot of people, folks, who have worked very hard to put this together and to make sure that we can be here together and have this conversation. There's a lot of people working together to make sure that we're moving this in the right direction. And I would be remiss if I didn't shout out some of our partners like Doctors Manitoba, who have been just a tremendous partner to work with. You guys have just incredible leadership at Doctors MB, folks who are advocating for you, who are bringing great ideas forward. And I want to thank Canada. The federal government has been engaged with us right out of the gate. They're actually a big part of the reason we were able to get X-ray as quickly as we've been able to. They have helped us get some of the lead walls that were needed to set this service up. So, everybody, all levels of government, Mayor Boziak and folks municipally, can't thank you enough. I want to thank everybody for working together. This is a big challenge that we're facing. We've never seen this before, but the way that we are going to get through this and come through the other side with something actually much better and brighter for all of us is by working together. It's a team effort. And lastly, I just can't thank enough all of the doctors, the nurses, the allied healthcare professionals, all the maintenance folks, all the restoration people, everybody who's on the ground showing up for Manitobans every single day. You folks are the people that we're keeping at the heart of this, along with the patients and community members who are counting on us all to work together through this challenge. So looking forward to seeing you folks again soon. We're going to host a space like this to keep you up to speed again. But you know where to find us. Let's keep taking care of each other, keep the lines of communication open, and moving this forward as quickly as we can. Thanks, everybody. Stay well.
Stay well. Happy Thursday. Have a good evening, everyone.
Thank you.
Good night.
Thank you.